Welcome to Beyond the Reps podcast, your favorite platform dedicated to discussing fitness beyond the workout. I'm Coach Adri.
And I'm Coach Kay. This podcast is dedicated to sharing our experiences in the fitness world beyond the reps.
Join us every other Wednesday to discuss our experiences as Black and brown women in fitness. We talk about everything fitness in and out the gym, and every time is a good time.
Are you ready, A?
I'm ready, Kay. Let's start the show. Welcome back to Beyond the Rest podcast. I'm Coach Adri. If this is your first time joining us, welcome. And if you are returning, welcome back. Coach Kay and I are so happy to be a part of your day today. So we are just going to get warmed up and check in. I want to check in with my girl. How are we doing? How are we feeling today?
Hey, girl. Hey. I'm feeling good. I feel like I got a really good, nice rest, but I'm still tired.
You look like it. You look refreshed today.
Yeah,
nice,
so it was
bright.
One of those things that I woke up this morning, I'm like, oh gosh, finally I got like more than like 6 hours of sleep, so it felt great. But I don't know, I feel tired still. Like I could go right back to bed and go to bed.
I think it's this daylight savings time. I think it's been since, I don't know, it just seemed like since them clocks jumped forward. I hate this time of year. I don't know what it is. It's like I feel like I want to be asleep all day, and it's lighter for longer now, and that don't make sense. That's like backwards. But yeah, no, I feel that. And last night I couldn't sleep, so I'm in the inverse of you. It's like I couldn't sleep, but then when I did finally fall asleep, I woke up and I'm kind of like, I don't feel like I'm tired, but I know I'm gonna feel like I'm tired at some point during the day. So it is what it is. Also, this weather, like being up and down, it's like when it's warmer out, I feel like it makes you feel like you're more motivated to get up and go outside. It took me so long today to get up and get out the house. And
we just had a fake little spring though too, so that doesn't make it any better.
And then it was snowing yesterday.
So today I was like, you know what? We back to the winter. I'm putting on my sweatpants and my sweatshirt. We ain't gonna be comfortable today because there's no way.
I ain't never stopped wearing my coat. Well, we know you don't wear coats.
Yeah, so. I don't like them. Just be cold,
man. But yeah, other than that, you're good though.
Yeah, I'm good.
Okay, good. I'm good too. I guess I'm good. You know, I don't really have nothing really to add in reference to that. I think because I do feel a little bit delusional right now because I didn't sleep like well last night. But other than that, you know, I'm good. I'm just going through the motions, getting through what I'm getting through, and it could be worse, right? So I'm very much happy that I'm where I am today. But we're gonna get into that in a little bit. Let's check in with our accountability real quick and how we're doing. What are we doing to contribute to those things? I will start. Still not really working out because of my injury. I want to be working out, of course, but it's not giving, I'm scared. I'm a little scared, right? So I do little things, but I would say it's kind of, my mental health is kind of suffering a little bit. Because I know I've mentioned multiple times on this show that and when I don't work out, it's a little sticky. So it's been a month and some change now since I've been to the gym. And I feel crazy. And you know what's I literally am trying to stay off the scale. I'm trying not to like critique myself and be so hard on myself, but like knowing that I haven't been doing these things. And it's hard. It's very, very hard. Like I did step on the scale today. I ain't gonna hold you. I haven't stepped on the scale because I told myself I wasn't, but I could see myself progressively getting smaller and smaller and smaller. So that is tough. So I don't know what to do about it because it's like I don't want to just eat and not lift. Because then that could be, and especially at this age, I don't know what's going to happen. Even though I know my body how it's been my whole life. As we get older, things change. So I don't even know what that's going to be like. And I'm trying not to be that. Thank God, I'm not an emotional eater, right? Because if I was an emotional eater, I would be eating everything right now. So that is, it is what it is. What else? I'm continuing to save money. I have no reason to spend money. I'm not doing nothing now right now. So I'm saving a little bit more money now. But one thing is keeping me lifted is reading the Bible. So it kind of balances itself out, I guess. But yeah, so I'm still reading the Bible. I'm still doing my, I have like 3 different Bible study books that I'm in. I did my Bible study doing my sister. I have one that's like reflective, like a book that you read, write and stuff, and another one that kind of just gives you like a scripture and like a passage to read type thing, but like no like reflection. So I have like a reflection. I have 2 reflection pieces, and then I have the one that's just kind of like comprehensive. So yeah,
okay,
that's where I'm at with it.
That's good. That's good. And I know it's probably, I already know it's tough for you, but you don't want to rush that process. So
I know.
I just know that you're gonna come back stronger than we were. So it's just a matter of time.
Yeah.
Because what you don't want to do is go back and ruin what you're trying to work towards. You know? So, well, that's good though. I'm glad the other 2 things are going great. For me, I had to say I've been doing really good with my savings. And then my other 2 were like kind of like hand in hand, which was the straight training and the cardio. So this has been like what, 2, going on 3 weeks now that I added NOB back. So I am getting my cardio back again.
Now, I am going to tell you, I did see you in a 6:30 class, but I ain't seen you in my 6:30 class, but I'm not going to say nothing about that.
We talked about my goal at NOB is the cardio classes. So go ahead and switch with somebody. Because the cardio classes, unfortunately, don't fall on your day.
That's okay. You could always, you still doing strength training, right? I'm doing strength training.
I am, but the good thing with that is then you try to tell me, go to the gym and start doing your own thing.
Okay, but you know what you're going to get when you come to my class. So you're going to get the same thing you would do if you went to the gym.
Don't be guilting me into this. However,
am I wrong?
I might have to pop in here and there though in the morning.
Well, now you're not going. I don't want you to come because I ain't going to be coaching until I'm cleared. So
see, even better. So I can continue my cardio for now.
I just wanted to point it out.
Get back.
I just wanted to point it out. That's all.
Cause 3 days in a row over there. I'm too old for that now.
But it's a completely different style. That's the point.
True. I haven't checked it out yet, so maybe I should check it out first.
That's the point.
All right.
Yeah.
But yeah, so that's been working out. So I had to do something because me personally, like my cardio is really like just like running outside, and this type of place we live at doesn't work that way. So that's really why I like the classes.
No,
not out, not in the cold.
Oh, okay.
So like in the summer,
I'm thinking you talk about
my walks and my jogs and stuff.
Yeah,
for sure.
Okay, you talk about weather.
And the weather-wise, it's just kind of like, it's annoying. So, so I got to find something fun to do. So that's why I'm like, I had to get, as much as I was like, I could add it, I'll do it after I straight train. It's not happening. I'm already in there for an hour and a half. I got to go when I'm done.
I know that's right.
So, yeah, so now we're just going to start shredding it all off now.
Okay.
So that's where we at. So,
all right. So good. Yep. Okay. Good. Proud of us. All right. Now that we are warmed up, let's get into our game time. Yes. So we got a little icebreaker for y'all today before we get into our topic, and our game time is going to be related to what we're talking about today. So, Kay?
I'm going to start it. We're going to do the icebreaker game time. It's going to be a this or that type kind of icebreaker here. So I'm starting with the first one, which you're going to tell me which one you like better, this or that. Emergency room or urgent care?
I'm going to say urgent care because I feel like urgent care, you have a better opportunity, a quicker opportunity to get seen than you go to emergency room depending on the severity of what you got going on. So I'm going to say urgent care.
Same. I say urgent care, and also because I feel like emergency room, everybody going there for a lot of different things. And I feel like it's just so many people in there where I feel like urgent care, it's not as many.
And you have more opportunity. I feel like in a general area, you can go to it's like urgent care here, urgent care here, urgent care here, as opposed to if you try to go to an emergency room, it's like you got to figure out, you go to ECMC, you go to wherever there's an emergency room, but it's like that one, and then you got to go somewhere else. And I feel like you can, just go 2 miles up the road, and you can go to this one if they're booked or whatever. So, and you can book appointments.
Yeah, that's care. What I like.
Yeah.
So yeah, I'm an urgent care girly because if I ain't dying.
That's what I'm saying. More than likely, if I'm not dialing 911.
But yeah, so yeah, I am definitely an urgent care girly.
Okay.
The next one, telehealth or in person?
I'm gonna say in person because I feel like I think telehealth is convenient, right, for certain things. But I also realize that you can't always get treatment for everything through telehealth, not accurately, right? And I feel like you need to go to the doctor in person to get treatment sometimes. So I would probably prefer in person, just because I feel like it's a little bit more like I can show you where it hurts. I can tell you, you can check certain things, whatever it is that's got going on, and then get the proper treatment, as opposed to saying, oh, I feel like this is this. Oh, it might be this. Like, it sounds like this. Like, you could tell what your symptoms are, but they may have other tests that they can do in person to check for whatever you got going on. So that's mine.
So I'll say in person as well. But I will say, like you said, telehealth is definitely convenient. So like for me, which we'll get into later, also when you have your one doctor, especially like a specialist, right? Like that's when I don't mind telehealth. We already know what's going on. Not going in, if we could just get it done over it. Like, cause sometimes it's just they can refill your prescription unless they seen you, right? And now telehealth does count as they see you.
Yeah.
For refill. Right. So definitely in person, like right now, what's going on right now. But when it comes to like specialists or something that, no, I'm not going all the way in there for all that. So we're just gonna call and say, hey girl, how you doing? I'm doing great, blah blah. And we're good. That comment. Right. Yeah. But I will say definitely in person. In person is my thing.
Okay.
All right.
So far we in agreement.
Yeah, a lot of this, I feel like we're going to be in a lot of agreement in a lot of this.
You think so? Okay.
I think so. So now, this or that for advocate loudly or switch doctors quietly?
I'm a advocate loudly, and then I'm a switch doctors. Because I feel like if you don't advocate loudly for yourself, then you switching doctor. I mean, like, I think, okay, feel like that. I'm petty. So I think it depends.
I'm petty.
Hey, I'm just saying, I can be petty. So I think that, like, if I feel like, well, no, I'm going to say both. I'm going to do both, because I'm going to be like, oh, I'm going to tell you, I feel like I need this, and this, and you're ignoring me, or you're not, doing what it is I told you. I'm telling you where I have pain. You're not treating me for it, and you're just continuously, and I'm under your care. You're continuously ignoring me. Then I'm just going to switch doctors. I'm not even going to tell you I'm transferring. I'm changing doctors, and then I'm just going to leave you in the dark about everything. So both.
Yeah. It's both for me too, because I didn't have to do this as well. So I'm definitely big about advocating, right? Because we live in our body every day, all day. Like, we might not know the diagnostic, right? Like, we might not know exactly what it is, because we ain't doctors, but we know our body. We know when something's right and when something's wrong. So I'm huge about, no, I told you this, and this, and you're going to tell me what it is.
Exactly.
So I'm very big about advocating, but I have no shame in my game on switching in a heartbeat. Are you not going to hear me? I'm going to get a second option, like a second opinion, Yeah, so it's both for me. It is definitely both for me.
Okay.
All right, let's see this next one. One great doctor or a culturally competent team?
I'm gonna go with the culturally competent team. Because I can have a doctor that's great, right? But then I also know that not everybody has the same experiences or level of expertise, right? So that being the case, it's like I would rather it be a team of people who come from different backgrounds and have different experiences, being able to chime in on my issue if it's something that, like, especially, I think that will prevent me from doing more of a doctor searching type thing or getting a second opinion. Because if I'm at one practice and it's a team of doctors, as opposed to being one doctor thinking that they know everything, like, you might be a good doctor, but maybe you might not be abreast on whatever this is, especially when it comes to whatever I got going on. So being able to be like, oh, we have a team of doctors here that can, assist you in whatever way. And I think I would prefer the team over the one. I mean, one good doctor is good, right? You want to have like a good primary doctor. You don't want to have a team of people at your primary that you got to rely on. But like, I feel like in certain circumstances and situations, having a team of culturally competent doctors, I would prefer that.
Yeah, I agree. I'll say the same thing. And for me, I say that too because I feel like with all my stuff, who helped me more was my practitioner nurse versus the doctor. To the it got to a point that I will always go to nurse practitioner. Like, so
Yeah.
I don't need one great doctor because half of the time they're not even around.
Yeah. Also, that's true. And even with the nurse practitioners, like I know, like at my OBGYN, like my nurse, like my nurse practitioner that has been my nurse practitioner for a while, like if I have to go in for a visit and she's not there, right? I've had better experiences with other nurse practitioners or doctors there than I do with mine, and she knows me the best because she's been dealing with me since I was 18, allegedly, right? So it's like you would think, but at the same time, it's like I feel like the level of care, it can be different because they're younger, they come from a different background, ethnicity, all of that stuff.
Yes.
And like, you know, Dr. So-and-so is not in today, but you're going to be here with such and such. And then I'm dealing with such and such, and they making me feel better than my doctor to be treating. I'm like, oh, hold on. I don't want to like leave my practitioner, but at the same time, it's like I'm okay with the team that they have there because it's like, okay, who do you want to see? At least I know like this person are competent enough to make sure that I feel like, okay, I'm confident in what they can provide me. So it's just the same thing applies.
Yeah.
Yeah.
Because I do go to like my primary is a bigger organization. So like when I first started with them, and I don't know, I had to be like 18, maybe 20. So yeah, no, I saw the doctor when I first started. I'm about to be 36. I haven't seen that doctor ever since. But he does have a bunch of good nurse practitioners. And I have it's like 3 of them that I'll go to. So I always ask for like, which one of these 3 are here today?
Okay.
So it is nice to have I feel like the team. And again, same thing. Like they all kind of have their own ways and they know how to do certain things. I just feel like sometimes not seeing the same person because it gets into a quick routine of, how you doing? You're going great? Okay, have a great day. Did I just co-pay for 5 minutes? Like, no. So I kind of switch my nurse practitioner when I go in. I don't go to the same one back to back if I have to go in. But I do like having a team versus just one doctor to see. Okay. Oh, this one is a good one. Family advice or medical advice? This or that. Which one for you?
I'm gonna go with the medical advice because 9 times out of 10, unless you've been through it, and even if you have been through it, our experiences might be different. My family don't know what the hell they're talking about. I don't have no medical professionals in my family. Like my sister works at healthcare, but like I'll listen to her and certain she'll say like if I'm dealing with something like, have you ever heard about this one at work or whatever? Like, oh yeah, you should do this, this, and this, and this, and like maybe I'll try it before I seek medical advice because sometimes going to the doctor can be a hassle. But I'm mostly gonna seek medical advice and to listen to somebody.
So I agree, but the difference with me is I do have a lot of families in the medical field, right?
Oh, okay.
So shout out to my sissy-in-law and Jania's dad or grandpa, Jania's grandpa. I go to him for everything. I be telling him, I don't know why you're not a doctor. But like anything's going on, or I'm gonna either ask my sister-in-law or I'm going to Jania's grandpa, like, hey, this is what's going on, and then get like. So it's kind of like family / medical.
Okay.
Because they're all RNs and been in the field for years now. So it's not just,
See, that's different. So, but if you got somebody that's working at like People Inc. or something.
Yeah, no, I'm not asking you.
And then like, oh yeah, no, all you need is this, and you don't know what the hell you talking about. I'm going to the doctor.
So sometimes I save my copays by asking them, but then sometimes they'll tell me like, yeah, I think this and blah, 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 but go check and do ask this. Or they'll tell me ask for this type of test. And I know that then the doctor will look at me like that's crazy. But I'd be like, no, that's the type of blood work I want to get done. And they just be looking like, where the hell did she come from with this information? I'm just saying.
And they be shocked when you find out information from other medical professionals and you go and say, oh, this is what I'm requesting this. They be looking at you sideways and be trying to figure out, because a lot of the times, like when we get blood work done, and I just learned this recently, that doctors don't necessarily give you all the options.
It's like a panel. It's like a general panel.
And there's different panels that you can get for different things. Yeah. So you can ask for those things if they don't. But you don't know. They'll be like, oh, we're just going to get you some blood work done. And they'll give you like a certain panel. But they'll leave out some of the things that could be missing that could fix what's going on. So, yeah.
So that's funny because like Janiyah, because her dad is in the medical field, like now that she's older and she just knows that. So that just even go to show a 13-year-old that will prefer her dad to go to all her medical doctor's appointments because she feels, and this came from her. I said, I always feel this type of way. I'm your mama. What you mean you don't want me to take you to a doctor's? She's like, no, Mom, like I don't want to be like rude or like, make it seem like you don't know what's going on. But like, my dad is a nurse and like that, like if we don't understand something, like he might know or whatever. So since she got, and this been like going on for a couple of years now, but she definitely makes sure that she takes her dad to any of her doctor's appointment, because she feels more comfortable having her dad there, knowing that it's someone that's gonna either understand or like she knows that he will speak up and advocate for her. So that I thought was, when we were doing this, I thought that was interesting because even as a child, she's like, yeah, no, I prefer my dad because my dad might understand a doctor, my dad might understand a nurse. Because I probably was feeling some type of way. I said, all right now, don't do me like that.
That makes sense though. But it does. That does make sense. Yeah. Like, yeah, that's good though. She's at an advantage in that way, and I wonder if she's gonna feel that way when she start going to the gynecologist.
So that's funny because I think in that one, it took her a while to even like have those conversations, right? But he's like, I'm a nurse. Like, you can't keep away just the feminine part of it, right? So I think in that she'll ask questions, but most likely she is not taking him with her. Not taking him. No, she not. But she's gonna ask her questions. Yeah. Yeah, she finally got to a point that, because that has to be awkward. So, but yeah, no, she asks her questions, and I'd be like, hey, if you could get some, go to your aunt, go to your dad, your grandpa, your grandma, all of them. I'm like, okay, they all got the medical side.
Yeah, that's good. She all set, and y'all all set actually. That's cool. Love that for her. Okay, was that your last one?
Yeah, that was my last one.
Okay, so I'm gonna bring in some quick questions, and before we get into our topic of the day. All right, so my first question would be, do you think that doctors take women's pain seriously?
No, I don't. Because I feel like they have this thing that because we are able to give birth to a child, we're just supposed to just be, I don't know what they think we are. I just had this conversation with Janiyah on our way, like when I went to go drop her off in here. Literally just had this conversation. Because she's literally told me, she's like, man, being a girl is not for the weak. And I hope people understand that. Literally, this is literally what she said to me on our way, like, to take her do her thing before I got here. So, yeah, no, I don't think they take ourselves seriously. I don't.
Me neither. I agree. That same sentiment stands with me. I don't think that they do. And I think there's enough evidence out there to show that that's not that is the case, that they don't take women's pain seriously. And like you said, it could have a lot to do with the whole we bear children thing, or it could also be something that's like within like the patriarchy of the system in general. It's kind of like, yeah. So yeah. Okay. Have you ever Googled symptoms because you didn't trust the diagnosis?
Yes, I have. Yes, I have. I sure have.
Have you diagnosed yourself?
So I don't think I have ever like actually diagnosed myself, right? When we talk about it later, I'll add more to it. But like when I was going through what I was going through, when I got diagnosed with what I got diagnosed with, I was like, okay, I hear you. I hear you. This kind of makes sense, but they weren't answering everything like what I was expecting, right? So, yeah, I was Googling because everything was like, you're too young and no one in your family has this. And I was just like, okay, and like, I'm telling you, like, this doesn't make sense. But yeah, so I have Googled because it was a lot of, it could be this, but it could be that. Or it could be this or that. And I'm like, okay, there's too much this or that for me. Like, so I started Googling the this and the that to try to figure it out myself. So, but yeah, I have Google for sure.
I've done both. I mean, I've Googled after they told me that, like, diagnosed me with one thing or said that it was one thing and then it could have been something else. I've Googled that, and then I've also diagnosed myself before going to the doctors and saying, I know that this is what it is. And if they tell me anything different, then I'm going to tell them that they're wrong.
But sometimes it be like that because sometimes they just take that very first appointment, not as a joke, because I shouldn't say it's a joke, right? But it's an experiment, whatever they want to call it, right? And then take all these different appointments when I'm just telling you, this is all that's going on, right? We should look into this, all at once. Why do we have to break it down to this? Here we go, 10 appointments later. Now there's something, now you know what it is. You knew what it was from day one. Stop playing with me. So, yeah.
Yeah, absolutely. All right. Have you ever felt rushed during an appointment?
Yeah, I have. And they literally sometimes even tell you that they got to get to the next patient.
Like, this seems like we're moving a little fast here. What's the rush?
Yeah.
Like,
so,
yeah, no, me too. I feel like often you can tell, but I could tell when a doctor or a nurse walks in the room and they're, especially like if you get sick during like holiday season or something, and or cold flu season, whatever it is, and you go there and you feeling symptoms, and I feel like they be like, all right, let's see, this. Okay, I'm gonna prescribe you some prescription, some medicine, go pick it up, see you later. And I'm like, dang, that was fast. I don't even know what just happened.
Yeah. Or when they listen to your heart, they only listen to one pump and they say, you're good to go. Like, hey, can I breathe? Have here when they say take a deep breath. They ain't do that.
They didn't even have me breathe. Like, hold on. Do you know what you're doing? Like, hey, hold on. Let me check my own heart real quick. Yeah, no, definitely. It's been countless occasions where I've felt rushed during an appointment. All right. So, last one before we get into our topics. If you had to rate your trust in the medical system from 1 to 10, what would it be?
It's a 50-50. I'll give it a 5. Because I feel like, no, I don't, to a certain extent, trust, like, when it's, like, smaller diagnoses. But then, if it's something real, real serious,
then it's like,
you got no choice. I got to trust you if you're going to make me live. So, yeah, I would say, like, a 5, 50-50.
I would say that, too, and I think that's very unfortunate. I think just across the board, I don't necessarily trust the healthcare system, the medical system. Not completely. I don't trust anything completely, but definitely not like to the point where it's like I feel confident. And I mean, granted, I think if there were more experiences where doctors, or just historically documented experiences where doctors have done better and taking care of patients, that faith in the system would be that number would be a little bit higher. But yeah, I think it's fair to say a 5 out of 10 for sure. Okay. Yeah. Okay, cool. All right, so now that we have gotten through game time and warmed up and everything, we are going to go beyond the reps. So obviously we're talking a lot about medical stuff today. We are not medical professionals. This is a disclaimer, okay? But we want to talk about being Black and brown people and experience in the medical system. So, as a disclaimer, this is not to bash doctors, but we want to confront a system that was not designed with us in mind. And I want to say that, like, me and Kay are both going to give like personal accounts and experiences on our in our lives in reference to these topics, because personally, I know I've mentioned a couple of times in our past episodes that I've been dealing with an injury. I was injured, and it happened at work. So like I'm out of work and all of this stuff, and my experience. And it's good to talk about this now because it's like happening in real time. And I've also, I think I told you, but I got some like different news now that add to the conversation. So everything's gonna tie in. So again, it's not to like bash doctors. I know we have good doctors and good medical professionals out there, but our experiences, I think it tells a story that needs to be continued to be studied and continue to be improved. So, So going back to the beginning when we talked about how a system that was not designed for us, right? Has been so much historical experimentation on black and brown bodies throughout history that shows that, one, they think that people that look like us are like stronger and like stronger, sturdier, more resilient, and not for nothing, the whole historical piece of them experiment on our bodies as if we were just property, right? There's so many. I mean, read a book, okay? Read a book. There's so many stories in history that will tell you. I mean, I can just bring up one that most people know about, Sarah Bartman, and she was one of the many people who was used and put on display as a black woman, and all of the things, right? They used to use the doctors used to use black women as kind of like guinea pigs and experiment procedures on us with no anesthesia, no nothing, that type of thing. So that creates the myth that black and brown people have a higher pain tolerance, and how we internalize that stigma placed on us. It in turn, and I think historically, because these things have been happening to us for so long, I can count so many times, especially like now in my situation, where it's like I'll sit in front of a doctor and tell them the pain that I'm feeling, and then they'll look at me and be like, "No, you good." and then it's like they gaslighting me. They like, "Wait, am I good? Like, I might be okay." Or I also know personally that I have this thing with myself where if I'm feeling something, it's kind of like I'll kind of want to push through that pain or fight through that pain and pretend like it's not as serious as it is. And low key, like where I am now with my back, like I feel like sometimes I had those moments where I felt like I wanted to just be like, I'm good. Like I'm just keep moving like ain't nothing happened. And then next thing you know, that pain intensifies. And it's like, well, girl, maybe you should be not doing what you're doing, right?
Right. Somebody sit your butt down and don't do it. Please don't.
And I haven't. I've been chilling. Okay, but good. It's even that mindset. It comes from that stigma that's placed upon us that we are just take it and push through the pain. So and I know that you said that you have had experiences, but like, have you had that experience, those type of experiences when you're in front of doctors and you're sitting and telling them something is wrong, or that you have felt pain that you like, I can just push through it?
Yeah, I think I have been there, right? So I feel like, especially like with my stuff, right? So I feel like, so when I was young too, I had to be like, man, this was like after, I don't know, I think I had to be like 25, no, I don't know, like 22, 23, right? So when I was seeing that first doctor, I feel like everything I was explaining to them, nothing made sense, right? So I'm telling them, like, listen, my hands, like, it's weird, like, when I'm carrying groceries, like, they lock up. Like, I wake up, they're stiff, and they're super hot and, like, swollen. And so they start asking me, like, well, does anybody have arthritis in your family? And I'm like, no. Does anybody have, like, just a bunch of different things, right? And none of my family really had any of that stuff. So I'm just like, no. So they're like, okay, well, I don't know. Like, so it was really like, I don't know what this could be, and never looked into it. So I was just like, okay, well, if that's the case, now, this is like right before I think I had Naya. So I was already working out and stuff. And I started noticing like the dumbbells hurt. Everything was hurting. And I said, this doesn't make any sense. But me being me, like, I'm not going to not work out. So like, I was just kind of like, okay, whatever. So that was my pushing through, because I felt like, well, I have always worked out. I might as well treat it like if I'm sore, I don't know, and just go through it. But I definitely feel like sometimes they didn't. Like, it was a lot at that time for me. It was like, you're just too young. You'll be okay. And I'm like, okay, if that's what you're saying to me, fine. But it started getting worse and worse. I'm like, okay, this is not normal, you know. And then when I switched, is when they did tests from, and I feel like when that switch also when you go to a new doctor. Yeah, they take your old, because you gotta send over your stuff, right? So that your old like history, blah blah blah, records, all that stuff. But when they go, I'm telling them, like, this is all the stuff that's going on. This is all the stuff I've been telling them. This is all the stuff that they have done, they have not done. So from the get-go, they were like, okay, well, we're going to actually sit here and do inflammatory, like do your thyroid, because I used to have thyroid, so I wasn't sure if it was that. They did all of the blood work within the week. They're like, whoa, I could see why they were saying you're too young for this, but really what you have, it is arthritis and the type of that. I would have a hard time pronouncing it, but it's rheumatoid arthritis. Yeah. Yes, which they were completely shocked. And they're like, whoa, you really are like young. Usually, like, you don't see this until like you're like a little older, right? So then they were digging a little bit, like, your family. You're like, I'm like, no, like no one. So like even my mom, everybody in my family, like, what, you have what? I was like, yeah. Said the blood work. Of course, I sent it to Josh and I asked Grandpa. I'm like, look at my blood work. He's like, yeah, what is that? You know. So it was just one of those things where I was just like, well, now what? Imagine me at 23, and then I'm like, like, I'm not stopping. Yeah. So there was time even in the gym. Right? So sometimes my inflammation, it doesn't just go just in my hands. Sometimes it really does go like all over the body, where I'd have the most, like, you know, that joint pain and all that stuff is in my hands. But it does flare up sometime, and it could be through my whole body. How many times did I not go to class in pain? Just because I just didn't want to, like, I'm still young. I'm not stopping. I don't want to stop.
Listen, I feel you.
So it's hard. It's tough.
Yeah, no, and you had brought up the point about the family thing, right? You asked you about family history and it's saying that you're too young. And what another thing that comes into play when it comes to Black and brown people, like, a lot of us don't know all of our family history. Like, I know personally, when I go to the doctor and they say, hey, does any family history of da-da-da-da, like, I can only tell them what I know. I can't tell them what I don't know, right? I don't necessarily have, like, all of the information from everybody. Some people have, like, a really big and close-knit family. I don't come from that. We all don't come from those types of backgrounds. So it's like, I can't say, oh, I don't know, maybe, you know, I know this, and this, and this. And from the information that I can gather, at least they can go off of that. But then at the same time, I don't know. And then telling you that you're too young for something is crazy, because there's not an age as to when somebody can develop some type of disorder, some type of disease, some type of whatever. There's not an age, like, like, yes, it's most common in certain amount of people, like certain age range of people. Like, obviously it's always going to be some type of factor in that way. But I hate when doctors say you're too young.
Yeah, it literally, like, blew my mind. And then when I really finally got diagnosed and got put on medication and started getting everything treated and stuff like that, like, I'm just sitting there, I couldn't believe it. So I got to Googling, who's the youngest person that had RA? Blah, 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 blah.
Who's the youngest in history?
In history. I didn't care. And then I started seeing, like, there's babies that are born with arthritis. Maybe not RA, but just in the family of some sort of arthritis. So it's just like, so for you to tell me in my early 20s that I'm just too young for this, and then, like, you know how, and it's crazy because I think about it now, and I think it was from, like, I probably spent like 3 years with all types of chronic pain, not even knowing what it was, and just kind of like, well, it'll go away one day. It'll go one day, you know? But yeah, no, I literally can't. I was just like, wow, like, that's all you got for me? There's no way it's that. You're too young. I said, that's crazy. And I almost, like, wanted to be so petty and go back to the doctor after I finally got everything. And I was just like, what if I go over and be like, all these fucking years you had me sitting here in pain, and this is really what I had, and I told you. But then I was like, see, that's when I will have to say the trust in the medical stuff started to kind of, like, because when I was younger, I was okay, the doctor said that, that's what it is. The doctor said that, that's what it is. I mean,
that's what they go to school for. You would think that if they're getting paid all of this money, you coming out of pocket or paying a copay, and they went to school for all of this and they got whatever their degree. you would expect them to know because that's their area of expertise. That's the reason why that they were in a position that they are. So yeah, that it makes sense to say, I'm going to the doctor. You tell them what's going on. They allegedly run tests and do whatever, and then say this is what it is or this is what it isn't. Who else are you supposed to trust at that point?
Yeah.
But then, like you said, when you have situations where you go somewhere and it's like, I hear you, but this don't make, like, you telling me your answer to me shouldn't, your solution and answer to me shouldn't be you're too young for it to be this. But did you check? Like, I might be too young. It might seem like unorthodox, right? It may be like a rare situation or something, but did you check?
And that's what kind of blew my mind, because I was just like, she didn't even bother checking.
That's the outrageous part.
She didn't even check. Like, it literally took me to go to a whole complete new, like a new complete new doctor, and tell him what was going on. I was like, and I told him, like, listen, I feel like they were not listening to me. I said everything. He's like, I'm like, I don't know what it is. I'm just telling you what my pain and my symptoms are. So
right, and that's all you can do.
It sounds like this, but you're too young for it, but they never tested. Can you at least do that for me? Girl, they called me right away. They didn't even wait for me to come back in a follow-up. They called me like, yeah, we're going to put your stuff. These levels are all over the place. I was just like, wow. So now if I take you and sue your ass, then what?
Exactly. Exactly.
I wish I would known about suing back then.
Girl. Girl.
Because what?
Yeah. So, and I also think this because we are underrepresented in medical research in general, right? If they didn't look at Black and brown people as human beings, the medical research that they did on us didn't necessarily pertain to us at the end of the day. And when they do look at us, they don't see us that way. So of course they're gonna say, "Oh no, this can't apply to you." But if I was Becky Sue coming in there, then it's like, we got to run all the tests. We got to figure out this, that, and the third. And I will say, like, recently in my situation, I went to the doctor. Went to the doctor to get checked and everything. I personally feel, even though I'm not a medical professional, I feel like but I may not be a medical professional, but I think me being in the space that I am in fitness and being a trainer and a coach, I know how the mechanics of how a body works, especially my body that I've been living in for 34 years. I know what my body feels like when I pull something out, of what it feels like when I feel like I might be injured, X, Y, and Z, right? I don't even know what this doctor did, to be honest, for the testing part of it. But it was so, and I'll share that I was hit by a car, right? So for me to be hit by a car and you to do this like half-ass like examination on me and say, "Oh, I'm gonna send you back to work," is insane. Especially to sit. No, and I'm telling you that the sitting makes the pain worse. But you're telling me to go back to sit, and I kid you not. It took me a while to find me a new doctor, but then as soon as I did, that doctor immediately pulled me out and immediately ordered me imaging, because the doctor would not get no imaging or nothing. And I'm like, you looking at me dead in my face, and I'm telling you what the problem is. And I'm also telling you that I need to get back to my life. This is not me trying to like pull some scam or whatever the case may be. I'm trying to figure out what's going on. And you telling me what? So it's even that part of it. It was like, this don't make no sense to me. It really threw me off. It really threw me off. I was like, I was not expecting that to be the response for something from an incident that from a doctor. Yeah, no, because when you told me, I literally was just like, what? How are you back to work? This doesn't make any sense. Like, you didn't just like fall. You didn't pull a muscle. Like, you got hit by a car. Like, what are we talking about?
Yeah, that right there is just the type of things that makes you wonder, like, what were you thinking when we talked about the field that we're both in, right? There's other people that have been out for a very long time who were not hit by a car.
For less.
Make it make
sense. Yeah. So, so because that is the way it has been historically, I think it definitely affects the way that we are treated today. And so I'm gonna let you take that.
Yes, so we are going to talk about like what it looks like today for us in our experiences, right? So there's a couple of different ones. I'll bring them up. You could talk about it if you have any experience, and if you don't, then whatever. We'll just move on to the next one.
Cool.
So the first one is just like, going to a doctor's and not just like doctors, because like for you will be what PT, right? So physical therapy or whatnot, or any specialist, right? Have you ever been told like it's just your anxiety, like it's okay, like you just going through something?
So low key, I feel like that was the um that was the like the vibe and the connotation that I was getting from the doctor. Like, yeah, like it's not that deep. Like you're okay. Like it's probably just because you're a little shooken up right now or whatever the case may be. Like, no, you don't understand. Like I wanted to get right back to my life immediately after. But once I start to feel different, my body don't feel the way it did prior to this incident, I know something's wrong. So don't tell me that it's just me being, scared or me being like anxious about getting back to the gym and stuff like that. Like, yeah, like I do want to get back to the gym, but it's not like anxiety is not making my pain worse. That's not what it is.
Right. Yeah. So I don't think I really experienced like that at all. But I figure like, the way that they're moving, or they were moving, I should say, right? Because at least finally you got someone that got some sense,
right?
And just give you the help that you need. But that's what I felt like it like to me, the way they were doing and stuff like that. I'm like, what do they think, that she just like nervous, or because it does, like anyone would be shaken up after something like that.
But I also feel like I've had that experience with like at the gynecologist, like when I was having issues and that like something was wrong off in my body, and I'm like, hey doc, like can I come in and get tested for this? And it was like I almost kind of had to tell her like, get me some blood work done, check my blood work levels. Like, oh, do you want to get blood work? You just had blood work done not too long ago. Okay, but not too long ago. It's not telling you what I'm experiencing now. Oh, maybe you're just stressed. Maybe that's why this and this is going on. Like, yeah, I mean, I'm stressed all the time, but I've always been stressed. So, right. Like, what are we talking about? Like, get me the blood work so I can see what's going on. And then they get the blood work back. Like, oh, yeah, it does show like it seems like you have this. Oh, let's get some images done. Oh, okay, so I can definitely say that you have PCOS. Like, okay. Like, I told you something was wrong. I've been going through my whole life and I've been getting imaging and stuff done. And it hasn't came up until now. So, like, why would you tell me that? Like, I had to push and push, and that's that advocating for yourself type thing. Push and push and push and be like, hey, can we just get some imaging and some blood work done just to be sure? It'll make me feel better. Because clearly you don't want to I don't know. And again, I don't know if it's a money thing. I don't know what it is, but it just don't make sense for, like, I have insurance for a reason.
Right.
Just
so I
get the damn testing.
Yeah. And I feel like, so a lot of the stuff that we're going to talk about is like being dismissive, like the doctors being dismissive to like our needs, right? So like I do feel like it goes back to money. It's all a business, right? But again, I'm paying insurance. Don't worry about my pockets.
Because they don't give a damn about your pockets anyway.
In the end of the day, like, because they're like, even for me, for my MRIs that I just had to get done, right? So I had got the first one, but then they had to wait until my insurance gave an approval for a second one. So so it was like, even a doctor had to tell me. Well, at that point it was the nurse practitioner, right? So she's like, this is now my rheumatologist, actual specialist office. And they needed to like check for other things as well, like what was going on in my body for the RA stuff, right? So first they're like, oh, well, we're going to do blood work. Like, they have to do step by step. And I was just like, I don't understand why we had to go through all this. So it literally just boils down to what the insurance is going to approve and get the approval, because then the imaging or the blood work or whatever that practitioner, like that office is asking, they have to send us out to get it done. They weren't going to set it without an approval. So I literally had to go through all this. I mean, she was obviously really nice and explained to me, because I had to, why, please explain. So it was like a whole, like, chain of command kind of thing, like blood work, PT, PT, MRI, another one. But like they have to see it, so the insurance just won't jump right into imaging until you do the other stuff. And I'm just like, well, who cares? Like if they don't cover it, guess what? I have to pay for it. So just put it through.
That's what I'm saying. Like why is it up to them to decide that? I don't understand it. Yeah, it doesn't make any sense. But like you said, I feel like it has to be a money thing. It has to be 100%. A money.
Has to be.
It has to be. So yeah, I agree.
Yeah. What about medication? Like being offered ibuprofen for severe pain.
Girl. Yes. Like, I don't understand. Like, I get, and for me personally, I don't like taking medications. I don't like taking medications. I don't care. Most times I don't care how much pain I'm in. I don't like taking medications. I just don't, because like even like during the incident, like, you know, they wanted to give you pain management stuff while you're in the hospital, and they asked me, do you want? Nope, I'm cool. I'm gonna thug it out, because I don't know first of all, I don't want no drugs in my system that I've never had in my system before. Like besides like ibuprofen, when I had to get dental surgery, they gave me some like what is it, the hydros.
Oh, yeah.
I didn't even want to take them. I was like, this is a narcotic. I'm not taking this. Okay. But at the same time, it's like when you are in pain, when I was in pain, and they would only prescribe me 800 ibuprofen. Girl, I can take 3 Motrins at home. Mm-hmm. You don't got to prescribe me this. Like, if that was the case, I had already tried this. So, like, what else can I do for pain management? Like, and again, that medication is only pain management. It's not a cure.
Right.
So, it's like, if I'm in that kind of pain, I would expect something a little bit stronger, just so that I'm not keep on taking these ibuprofens or keep on taking and messing up the lining of my stomach because you think that it's not appropriate to give me something stronger. Like, I'm not an addict. So.
Right. And it's so crazy because ibuprofen is just offered like it's candy. And then on top of that, like, yeah, after a while, it don't even work because your body get used to it. Because that's blocked for however long. And then what?
I promise you, like, I grew up with like terrible, like the worst. You think about the worst period you can think of. That was me my entire life up until probably like my late 20s, early 30s. Right, things started to calm down. But like, you know, when I say the worst, like you think of any symptom, I had it. And even then, it's kind of like, and that kind of goes back to us not being experienced or not having experience in that. Like, my mother didn't go through stuff like that. So like when I was the first one to go through my cycle in that way, my parents thought I was like faking it.
Remember we talked about that?
Yeah.
That happened with Janiyah and I was confused and you're like, no, believe her. And I was
believe her.
Because why? And even now, like,
yeah, like you throwing up and this is not a joke. Believe it. It's not a joke. And in the ibuprofen thing, so it's like only thing I knew was to take ibuprofen. And when I tell you, I used to be eating them ibuprofens like you said, like candy, fucked up the lining of my stomach, bad. Because it was like that. It was literally like it didn't do anything for me. Like I needed something stronger. And it just was not given to me. And then it was always like, I feel like the solution was always to get on birth control.
They brought that up for Janiyah. I said, birth control? Are you crazy? You sound like she is not about to get on no damn birth control.
And as a kid, all I know about birth control is that it's to prevent pregnancies. Well, I'm not out here having sex. So I don't know what the hell I need that for. But at the same time, I also didn't realize that birth control was like a hormonal thing, and didn't know like what it could have did to my body. So thankfully, you know, I wasn't on it. I've never been on it. But at the same time, I had to deal with that type of pain all my life. Because even as an adult, like when I was able to make my own decisions as far as the medication and stuff, still doctors only prescribing me, asking for birth control. It ain't nothing else. You telling me of all the medical research out there, ain't nothing else you can give me for this pain management but some ibuprofen? Yeah. Not doing it.
I don't understand. And it's almost like they offer for anything and everything. So you're telling me this medicine works for everything. 800.
Go get them 800. They just passing them out.
What?
And it just don't make sense. Like even like with like sports injuries and stuff like that, I feel like I've had, like I injured my shoulder before. What did they prescribe me? Ibuprofen. That's it? can I get a muscle relaxer or something? Like, what's going on? Like, I don't know. They do. They be passing that out like, yeah.
I don't get it. I don't get it. So okay, so it wasn't just me. Got it. Okay. Now we talked a little bit about this, right? So what about delayed imaging and testing? So I know we talked about it. So I'll talk a little bit. So when I got, so thank God the my arthritis specialist now, like I love that office. They're really good, right? So I started having these other pains around like my pelvis and like lower back. So like my chiro is kind of like, oh, you know, it might be this, it might be that. It might have been a injury from working out, right? And I'm just like, yeah, you know, I talked to my primary. It be the primary, man. It always just starts there. Because you always, for something new, they can't just send you straight to a specialist, right? So you got to go. So I'm like, here we go again. Like, I have no issue with my specialist. It's really be the primary, right? So I go back over there, and I don't know. You'll know. How long have I been complaining about his pelvis, lower back? It has to be like a year and a half now.
I feel like longer.
Yeah, like literally, yeah, maybe like 2 years.
Maybe like 2 years.
Yeah.
Yeah.
Do you know they just finally figured it out? And what's crazy is that my primary, to this day, still have not even tried to figure it out. So I'm telling them, they're like, is your RA? Is your RA? How? My RA is in my hands. Like, it's possible that it could be moving around. I know that I could tell when I have inflammation. I've been having that for a while. Now I know what it is. So if I have some type of inflammation, I know. So then they like pushed me off to RA, talk to your RA specialist, right? So I'm talking to them and they're like, they sent me for testing, nothing. Like, yeah, my levels are still high because obviously it's going to come because of my hands.
Right.
So now they're like, they did x-rays, nothing. They're like, oh, nothing. They did the MRIs. They're like, because they're looking for RA, right? Because that's what they're that's what the specialty is. For. And this, I'm like, well, I don't know. The primary is not doing anything. Like, they're asking for you guys. So they're like, kind of like, what? Okay. Kind of find out. It all comes back to what my chiropractor said. It was a sport injury. So I ended up coming to find out what I really, so all these, if I would have known this and they didn't keep pushing it, and this whole time I'm like, okay, then I guess it is my RA. Because at that point, I'm like, what am I supposed to do when this is what it is? This is what they're telling me, right? So, and it was a similar pain from my hands, so I didn't know, but it's because I had, like, what's that called? Tore one of my, muscles around the groin. Okay. So, because of that, now that makes sense, because with my hand, that's all part of my joints. And what I tore was a joint. So that's why the pain was similar. Okay. But it wasn't really that. So kind of find out it was a sport hernia. And it goes in the front, like in your groin by the pelvis. Yeah. So it must have been either from lunges or like squat or just too heavy weight, like the weight being like either too heavy for my squats, either lunges or stuff like that. Trust things like that. It could have been what caused it. So now here we are working backwards because now I gotta do PT. Working backwards. That's just
because come to find out, I shouldn't have been doing PT first. I should have been doing what I'm doing now.
Working backwards because of what they think it is.
Like delaying, and I guess the delay imaging is kind of like I guess I don't understand it, and it doesn't make sense to me because didn't make sense to the new doctors either, right? Why is it that I didn't get all imaging done first before we just start? We can't have I feel like you can't have a recovery plan if you don't know what's going on.
And you can't even they can't even do the correct PT program without all the imaging. So that's why I don't get it.
But I think the PT programs are always based off of what the doctor's diagnosis or review was. But if the doctor's diagnosis or review was incorrect, because they didn't do any imaging, I feel like you shouldn't even be able to diagnose people without having all the proper imaging done first.
Yeah, no. And how can you possibly do PT without the imaging? Because and then that's why there's a difference between a X-ray and an MRI
and a CT.
Right. there's 3 different things for 3 different reasons. Mm-hmm. So like my primary did all X-rays. Ain't nothing going. It's all more joint.
Right.
Everything,
you're not gonna see that because
that's for
you're
the
just
bones.
checking for bones. Exactly. Like again, you don't have to be a medical professional with a degree to know this stuff. Like, please be so for real. Like, what are we talking about? When you suggest certain things that you feel like you should be getting, imaging or whatever the case may be, they look at you like, who the hell are you talking to? Because I'm the doctor here.
Yeah, the like, pushback is crazy. The pushback be crazy.
And I don't understand that. Because it's like, it's clear. But also, in my experience, like, the first doctor didn't have nothing, like, even after the PT suggested, hey, let's get some imaging, still no imaging ordered. But as soon as I go to a different doctor, the first thing they ask for is, where's the imaging?
Yeah, because they need, that's what I'm saying.
You didn't have no imaging then? No. If I could make my own imaging, I would. But I can't. But I don't, so I ain't got none. And they just looking at me crazy in the face like, well, why not? Don't ask me, ask old boy.
Yeah.
I don't have an answer.
Yeah, and especially with your type of situation, that should have been an automatically imaging. Are you kidding? You know what could happen when you get hit by a car? Like, from that day and then weeks later, like, a lot could change. Like, what are we doing?
What are we doing?
Yeah, that stuff is crazy. Yeah. So that actually just lines up with the chronic pain. And that's technically the other thing, dismissal to the chronic pain or OBGYN, where you could probably talk about that a little bit, or the autoimmune. But like for me, it was the chronic pain. Like, because it was just like, there's no way. I really just go for now it makes sense. Like, yeah, if I pull and tore my, like, some type of tissue and joints in my pelvis groin area, now that makes sense why I went for a 3-mile walk and then the next day I could barely walk.
Yeah,
because I'm pulling and pushing and pulling and pushing on the stuff that I was, I tore, that
you need to heal before you start to use it that much.
Wow. So yeah, I feel like in a lot of, like, especially this whole topic we talk about, a lot of stuff was very, like, they dismiss it, like like, you're okay.
It's like, oh yeah, no, you good. Like, like, yeah, I mean, I know I spoke on the blood work and stuff for, like, when I got the PCOS thing, and it's like, and at this point it's like, I could be a doctor, because, like, I'm telling you all the symptoms and what I think it is, and you telling me no, it's not, and I'm just like, I'm like, I think it is. I'm coming back next week. I need another appointment. I'm still having these problems. I'm having these problems. Can we get some blood work done? So that, I think, is where, like, I experience a lot of that. Like, just, I feel like over the years in general, it's like, even when it's like something that seems like a little bit more minor, it's still like, no, I think it's this. Like, I really do think that I need to get tested for this. Can you test me for this just to make sure? Or can you test my levels for this just to make sure it's not something else, like, whatever? Because, like, I can tell you, like, even when I was younger, like, I had, like, to get, like, I had, like, these, like, little, like, sores on my leg as a kid, and they had to, like, cut them off to get, like, a biopsy of them. And they said basically that it was, like, pre-diabetic stuff, like sores or something like that. So, like, it said as you get older, you may develop diabetes. So at a point, I was having, like, issue. Like, even now, I still don't know. Because sugar makes me sleepy. If I eat something, that's why I don't eat sweets. Part of the reason why I don't eat sweets, because it's like, if I eat a candy bar, I'm ready to go to sleep. If I eat a dessert, I'm ready to go to sleep. Sugar makes me sleepy, and I tell my doctor that, and I'm like, oh, maybe it's something, like, maybe it's like a diabetic thing. But then they say they'll check my levels or whatever. I don't know what the hell they're checking for, but they always say everything looks good. But I still don't believe it. I don't believe it. I believe that there's something going on. Because I've never personally ever heard anybody say that sugar make them sleepy unless they're diabetic.
Yeah, no, I'm like,
that's not normal, right? Like, do sugar make you sleepy? Got diabetes. Okay, and I know there's 2 types. There's type 1 and type 2.
Type 2, yep.
But, I mean, I'm sure one of them...
Yeah, no, because I don't know, well, I love me some chocolate, and that doesn't make me sleepy.
It don't make you want to go to sleep. Like, it's like, if I eat it, that's why I don't eat. Like, even with when we were talking about them Fowler's joints, I eat like 2 squares. I can't eat no more than that. Because if I do too much sugar, I'm going to sleep. I'm like instantly going like this. You would think I was a narcoleptic.
Oh my god,
It's bad.
That's so crazy.
Like I'm like, yo, why am I so tired?
Yeah, unless you have some type of.
Yeah, so there's some type of resistance there, and you would think that it would be, but again, the doctors tell me that, and I watch in 10 years, and be like, oh man, you know what? I think you're diabetic.
Surprise!
No. Again, like I need my medical degree at this point. Like I need an honorary medical degree because like I could have told y'all that years ago. So yeah, but yeah, is that your last point?
Yeah, that was my last one.
Okay.
Yep.
All right, so just want to talk real quick before we wrap up about the emotional and physical toll that it has on us. So, number one, being avoiding doctors at all costs. I could definitely say that if I had the option to, anytime in my life that I've had the option to, I will avoid the doctor. Like I just told you, I'll diagnose myself. I'll go online. I'd be like, oh, it must be this. Okay, so then I'm looking for natural remedies to fix it. And if I know, like, if it gets to a point where it's like, okay, this ain't working, now I got to go to the doctor. But at that point, I've probably been suffering for a little while. But avoiding doctors, like, is that something that you've experienced? Or are you like, I'm going to the doctor regardless?
No, I feel like I avoid. Because especially, like, I really hate going to the doctors. And all the doctor's appointments are while I'm at work. I don't got time to put PTO time in. So it just gets like, it's more than just me. But yeah, I would have to say I avoid. Like I really have to be what made me go and really push it was when I took that 3-mile walk and I couldn't walk the next day. Like I literally could not walk. Like I was in so much pain. I'm like, there's no way I should be in pain from walking. That's ridiculous. So it would have to be something crazy for me to be like, all right, I guess I'll go. Because sometimes I feel either rush or they're just going to not answer what I'm asking anyways, and I just wasted my time there. So I will avoid unless I have, like, either really, really bad pain or I really feel like, all right, this is just, I've been dealing with this for too long now. Maybe I should go check and stop trying to avoid it.
Yeah. Yeah. I mean, but yeah, I think that's the backwards way of doing it sometimes. But I mean, granted, like you said, it's like sometimes you go to the doctor and you feel like you're wasting your time. So it's like, I'm like, if I feel like I can figure it out on my own, like you said, if it seems pretty severe, then yeah, obviously I'm going to the doctor. Like I gotta go see somebody. But 9 times out of 10, I'd be like, I can figure this out myself. And then, we'll see what happens. Also, the overcompensation that we do, especially when we're working out, when we're injured, like we know something's off. Like when I injured my shoulder, I was really trying to like work through it. And then it just got to a point where it's like, I can't even do this. I said, I got to go see somebody about this. When I feel like I couldn't even raise my arm up just this much. I was like, oh, this hurt. This is crazy. I knew I had to go to the doctor. But I'm doing all types of rehab stretches and bands, all types of stuff, thinking like, oh, yeah, I'll just hold this, do this every day. And it just turned into like, no, you need to go see somebody. And then the times I had like a tear in my rotator cuff. I would have known that, and I couldn't rehab that properly. I would have had to rest it and do the proper things. But yeah, I can definitely say, like, I've also had, like, knee injuries or, like, where I probably should have just sat down and I'll just wrap it up and, like, or really lean to one side more than the other to overcompensate and kind of correct that. And wrong, don't do that. Figure it out. But I've done it, just to avoid going to the doctor or just to kind of sustain and pretend like nothing's going on for real. Like it ain't that, like back to the whole we just push through it type thing. Like it ain't that bad. Like it could be worse, right? Yeah. And I know I've done it. I tell my clients all the time, don't do it, but I've done it before. I don't do it as much no more. I feel something off. It's off.
Yeah, no, I have done the same. I have. Especially like, like with my situation, like with my RA, right? Like, because like someday I could go weeks and months perfectly fine. Like no flare up. I'm good. I could do all this stuff. So I think that's why, like, especially in these last couple of years, and I don't know if it's from getting older, like, 'cause they did say, like,
age definitely plays a factor.
It does play a factor, right? So even in my imaging in my hands, right? And I'm like, please, God, please, don't. I hope my hands don't get crazy when I get older, because they look crazy.
Oh, they could be. You be like one of them little old ladies like this. Oh,
so they do imaging every few years to check, and then they don't look like how they used to, right?
Oh, okay.
Yeah. So like, I just be hoping like it doesn't get worse. I be so sad. I be like, please don't.
Dang.
So it does. There is a couple like finger that have more like you can see where the arthritis is attacking it, right?
Damn.
So it's like some months are better than others, and this last like 2-3 years have been so crazy for me because I feel like the flare up been like way more than others, and like now I feel like compensating in one area than the other, because then I think that's what I think happened to me with the whole sport hernia. Because then what did I do? Well, I will just won't work on my upper for now, and because for upper I need my hands for the upper.
Yeah.
For everything upper I need my hands. So I started focusing on my lower, and I think that's where the sport hernia came in, because I was just going ham on the lower because I was so it does get like it'd be annoying sometimes, but it also like for me like opened my eyes though too on my journey too of like even just like the weight versus like and stuff like that. So that I will have to say at least taught me something to just work on what can you do, and when stuff change, it's okay that I can't do what I was doing back when I was younger, and that my routines and my fitness journey looks completely different now. And it's okay. And my goals are different. Before I want to look a certain way. Now I don't care. Like I know I'm strong and I know I want to be healthy. That's it. That's all I'm looking for. So, but yeah, I did compensate a lot. Yeah. With trying to figure out this or that. But
yeah, it happens. It happens to the best of us. It happens. I think it's a perfect time for us to flex and reflect.
Yeah, so we're going to flex and reflect. So we talked a little bit about this. So how to advocate / acknowledge good doctors? Like how would you do that?
Honestly, I think that the importance of like once you find a good doctor, like make sure that you acknowledge the fact that they are a good doctor, right? Because I think you in order to be able to acknowledge a good doctor, you have to have experience with bad doctors, right? Or doctors that did not care for you in the way that you deserve to care. So I think it's important to let that doctor know that thank you for telling me, like seeing me in this appointment and telling me and doing what's required to get me to where I want to be. Like appreciate that. And then obviously continuously advocating for yourself throughout like that time period. But I think acknowledging good, like I don't know how doctors get their reviews and stuff like that, but I think it's important to definitely acknowledge the ones that are good doctors. And then also put the ones that aren't good doctors on blast. I'm good for a Google review. Yeah. Well, I'm gonna get to typing.
But no, for real. Yeah, I feel the same way. Like I'm gonna always advocate for myself. That's something that I think in my fitness journey, especially after these last couple of years, I think if you watch like a lot of my stuff that I post and stuff, I'm constantly telling people like, listen to your body, you only know your body, and advocate for yourself. Those are my huge, and that's for everything, not just fitness, like just period.
In general,
just in general. And then acknowledging, like I said, like I love my nurse practitioner and like the other nurse, because I have also another nurse practitioner for my specialist. Yeah. And I'm constantly telling them, like, listen, I have to tell you, like, thank you. Yeah. Like, how long, so I'm constantly, like, giving them their flowers when they need it, because they need to hear it. There's people out here that do not take the time to look into what you need. And if you're taking the time to do that for me, I appreciate it, and I'm gonna let you know that. So,
and I think that's a part of the ecosystem. I feel like in order for us to all work together in a positive way, we have to be able to acknowledge and give people like acknowledgement to where credit is due. Like it's just like us being coaches. If nobody ever told me that they were getting something from my training, or they don't appreciate what I bring to the table when it comes to fitness, like I don't even know if I would feel like I'm doing enough, or I'm doing my job, or I'm contributing to the space that I'm passionate about. And a good doctor is as passionate about helping their patients. So letting them know helps them to continue to be better at their craft and continue to treat patients with the care that they deserve. I personally think, because I think in any field, if you are good at what you do and you love what you do, you're going to put your best foot forward at all times. And when you don't get feedback, how do you know that you're doing a good job? So,
exactly. Yeah. So like one thing I would like to let like our listeners and just everyone out there know is like your pain is real. Like don't let nobody else tell you what is real, what is not. You're living it, you're feeling it, right? Your body, it is not dramatic. Because a lot of people, you're just being dramatic. No.
Some people do be dramatic, but most times I feel like you know who the drama queens and kings are, as opposed to people who are actually saying something that something is wrong. So yeah, no, I agree.
Yeah. So I would tell, like, for me personally, like from my experience, right? Like, I bring notes and I'm gonna ask you 1,000 questions. I'll be in there with my phone. Hold on, let me see what question did I ask you. This one. Okay, cool. So me personally, from what we have spoke in this episode so far, bring your notes, ask your questions, okay? Don't push through no injury. Rest if you have to rest. Please do not be afraid to get a second opinion. A lot of people feel like they're betraying or they're not being loyal to whatever doctors, because a lot of people have these doctors for years, right? I don't care.
I feel that way now. I feel like it's a couple of doctors I got to break away free from. I got to set myself free, because it ain't feeling like the care that I think I deserve. And it's like the familiarity thing. Like sometimes they get too comfortable. And it's like you can't let them get comfortable in their practice, and then once you challenge them, if they give you pushback, you're gonna push your way out the door. So yeah, don't be afraid to leave that doctor. I will definitely say that. I agree. I agree.
Because I like the doctor that I had, and it was funny because it was like a doctor that it was like a family doctor. So like all they did was once I turned 18, said your mom no longer coming, you come. So I had them for years, like years, and I was just like, But when I noticed that, I was like, yeah, I'm out of here. Yeah, because you're not listening to me anymore. Period. You talk to me like, hey girl, how you doing? Like we friends. Do your job. Yeah. Don't hey girl me.
Because ain't no hey girl.
Professional. Come on.
Let's keep it professional.
But yeah.
Okay. That's great. That's a great advice. I don't have nothing to add. So, that was a good talk. We hopefully will be having a part 2 to this episode with a medical professional on here to get a little bit deeper into the things that actually happen in the field from their perspective. So again, if you are someone in the area that would like to be on the show, shoot us an email at beyondtherepspod@gmail.com. We would love to have you. And find out what your experience is as a medical professional, as a Black and brown professional, and what types of things you go through, what you've seen on both sides of it, being on the professional side and being a provider. So, yes, that will wrap up this week's episode of Beyond the Reps. Thank you for tuning in. Anything you want to add, Kay?
No, I think, like I said, just listen to your body and advocate for yourself. And don't be afraid to switch if you have to switch. That is it, and that is all.
And truly, that's great advice. Great way to wrap it up. Thank you for tuning in. Make sure you like, share, comment, subscribe, all the good things. And we will see y'all next time. Bye.